Thank you so much for joining us for another edition of All Angles. I'm Dion Jax Miller. So why are healthcare workers again upset with the Health and Wellness Minister, Dr. Christopher Tufton? He says he's calling for accountability in the public health service. Some of them say he's throwing them right under the bus. We're going to be talking about some of the issues we have in studio with us. We'll be hearing from a little later Dr. Renee Badro. She's president of the Jamaica Medical Doctors Association. Also with us, Dr. Vanessa Kiffin, who is president of the Jamaica Association of Public Dental Surgeons, and Dr. Merton Smith. He's an executive member of the Association of Government Medical Consultants. Now, first though, this is one of the comments that the health minister made on his social media page. He was talking about the money he says the government has spent in the public health system.
The government has in fact made a significant effort over the last 10 years to resource the health system by putting more money in the budget, hiring more people than any time before, and building out infrastructure, some of which is yet to be opened, but represents significant hope going into the future. But guess what? We have a problem. And leadership requires a conversation around that problem, even where it makes some of us uncomfortable. 24,000 employees in the system. The system only works when everybody plays their part.
So earlier today, I spoke to Dr. Tufton to try to get some more information about exactly what he says, what it is he means. Take a look. And the Health and Wellness Minister is with us in this segment of the program. Thank you so much, as always, for coming in, Dr. Tufton. Now, at the recent signing of the accountability framework, which we will be talking about, one of the things you said is public health does not have a resource problem. You said we have a management problem. You said we have a leadership problem. You still stick by that?
Yeah, I mean, I don't speak in extremes, and hopefully it's not interpreted as such. I'm sure there are areas where more resources could help. But part of the accountability framework is accounting for the resources. And so that's very clear. One element of it is for the public bodies, 13 of which fall under health, to ensure that their annual financials are filed. Some have not filed in many years. Others have been working diligently, like the regional authorities. When I became Minister of Health, some were outstanding 12 years in some instances. They are now down to 2 and 3. I've said to them, get external help if you need to, but you can't be asking for more money if we don't know, based on our audited financials, how the money is spent. And it's actually required under the law. So that is part of the 12 to 18 month cleanup that is required. And of course, there are other elements. So I am sure there are areas where money would be required, but I did make the point that the budget has gone from 60 billion to 140 billion over that 10-year period. That's a big increase. Doctors and nurses are making more money, and administrators. More prescriptions are being given to people who need prescription. Many health centers have been built out and modernized. And of course, many hospitals either have been or are being, the big ones, of course, being Cornwall, Western Childs, Spanish Town, and so on. So it's a work in progress, but I'm prepared to say that the extreme positions that have been taken, like surgeons wearing garbage bags to perform surgery, is no longer the case in public health. It is how we have to prioritize, it is how we manage. And that I stand by that.
Well, just to make the point, though, that when you speak about the increase over a 10-year period, that we've also had inflation over that 10-year period. So it's not dollar for dollar. All right. So there's been a lot of comment on social media. Lots of healthcare workers upset. Let me just share a couple of comments with you. One senior doctor said, I can't understand why he's taking that stance. And he knows the circumstances of hospitals are not properly equipped. Yes, some consultants don't do anything, and they should do something about that, but others work long hours and spend their own money to get the work done, and then he goes and abuses the staff. Doctors are angry. Let me ask you to respond to that one first.
I can't assume that a comment or 2 or 3 or 4 means that it is the generalized position within the system. We have 24,000 employees. We had under 20,000 when I became minister. So we have expanded this cadre of staff. We have departments that are absolutely excellent. And part of the accountability framework with the quarterly report will be to recognize the centers of excellence and the individuals who have performed excellently, not just the bad side. So I am prepared to accept any criticism. And I knew that there would have been criticisms. What I want to do is to engage a conversation